consistent really helps your staff. Our technologists are so good, and I'm going to get a little emotional, but they do such a wonderful job every day for us, and they put their heart and souls into taking care of our patients for us. And they're the front line, and they're the ones that are out there every day, doing the hard work. And they want to do a good job for us. You ask any technologist, they really want to do a good job, and they care about taking care of their patients. They want to take the best care, and really using these specific skin markers helps them communicate. So it makes it easier for them to tell us as radiologists what they're marking, why they're marking it, and it just really helps take care of the patient. And my technologist, like I said, really they become part of our families, right? As we work with them for years and we get to know them, and they really care about their patients, and they care so deeply and passionately about the work that they do and the great work that they do for us. So just really to summarize some of the things that I think we need to think about in our practice is, are we following the guidelines set out by the ACR? Are we doing best practices? And I think we should challenge ourselves to really recognize what is best for our patients, and what is really the standard of care. And so really recognizing what the ACR puts out there, and they really recommend using markers and using different markers to delineate the differences, such as palpable areas, skin lesions, scars, those sorts of things. And so just being cognizant of that fact, and really going back and maybe looking at your protocols and seeing, are we doing things appropriately? And I certainly appreciate when you have different partners and different doctors who feel a certain way. One of the things that I find helpful is sort of gathering together and talking through, why do you not like it? Maybe there are seeing the slinky artifacts because you haven't upgraded your markers. Maybe there's something else that's prohibiting from people being consistent with the protocols. So I just would challenge you to look into it and see, again, what makes most sense for your practice. At the end of the day, the best patient care comes from the radiologist getting the best information and the technologist relaying that in the fashion that works the best in your system. And in conclusion, I think many of us are seeing more areas of distortion with the advent of tomosynthesis. And it's really important to have that communication between your staff and you as the end user, and documenting that, how you document that, the fashion that you document it, and really being consistent. So the more consistent I can be, the easier it is for me, and the more confident I am in making my decisions. And really, it's important to understand there are markers out there now that are available specifically for 3D tomosynthesis.